Hello everyone. After having discussed about the very important hematinic, that is iron, let me take up the discussion of the another very important hematinic, that is the folic acid. Folic acid, it is required for the synthesis of the RBC, and the deficiency of this particular folic acid will result in megaloblastic anemia. Right, will result in megaloblastic anemia. So, in the iron, what we have discussed, in the iron, the deficiency of iron will cause microcytic hypochromic anemia, whereas the folic acid deficiency and as well as vitamin B12 deficiency, both of them will cause megaloblastic anemia. Now, what does this folic acid consist of? Folic acid, it consists of the three important substances. Number one, pteridine. Right, it consists of pteridine. Number two, very important substance is para-amino benzoic acid. And lastly, the other important substance is the glutamic acid. So, these are the three important substances that you will have within the folic acid, right? It consists of your pteridine, para-amino benzoic acid and glutamic acid. Now, whatever the folic acid that is available in the diet, right? That is, your dietary folic acid is in the form of polyglutamates, okay? So, right, the dietary folic acid, it is in the form of it is in the form of the polyglutamates, okay. So, this will be your dietary form of the folic acid, and these polyglutamates, these are cleaved off in the intestine. Right, these are cleaved or these are broken within the intestine before absorption. So, so please remember, this particular folic acid, which is in the form of polyglutamate, it has to be broken, right? It has to be cleaved off within the intestine before absorption. Without cleaving, the polyglutamates, they are not absorbed. Now, where exactly is the site of absorption of the folic acid? So, regarding the iron, we have discussed the site of absorption is at the level of the duodenum, whereas if you take the folic acid, the maximum absorption, it occurs at the jejunum. Right, the maximum absorption, it occurs in the jejunum. Now, what are the series of the metabolites that will be formed? So, this folic acid initially, right, this folic acid, it is initially reduced to first dihydrofolic acid, right, it is reduced to first dihydrofolic acid, right, DHFA stands for dihydrofolic acid, and then it is converted to tetrahydrofolic acid. Right, then it is converted into tetrahydrofolic acid, that is the THFA, right? And this tetrahydrofolic acid, we also have methylated form. This tetrahydrofolic acid, once it undergoes methylation, then you have what is called methyl tetrahydrofolate, okay. So, this tetrahydrofolate or tetrahydrofolic acid, this is methylated. So, once it is methylated, you will have what is called methyl right? This we call it as methyl tetrahydrofolate. Now you take this particular methyl tetrahydrofolate. It is the main form in which it is transported into the blood, right? So this is the main form, right? This is the main form which is transported which is transported into the blood. Okay, that is your methyl tetrahydrofolic acid. Now this tetrahydrofolic acid, what is its importance is it participates in many one carbon transfer reactions, right? This tetrahydrofolic acid, it participates in many one carbon right? It participates in many one carbon transfer reactions. Now, what are some of the one carbon transfer reactions? Very important among these are conversion of homocysteine to methionine, right? Conversion of homocysteine to methionine with vitamin B12 as an intermediary carrier. Let me just tell you about this one carbon transfer reactions in which the tetrahydrofolic acid is very much required. So let me shortly recap this particular folic acid. It consists of pteridine, para-aminobenzoic acid and glutamic acid, and deficiency of this folic acid will result in megaloblastic anemia. And the dietary form of the folic acid, it is available in the form of this polyglutamates, and these are cleaved off in the intestine before absorption, and the major site of absorption of the folic acid is within the jejunum. And or this folic acid, it is reduced to first dihydrofolic acid and then to tetrahydrofolic acid, which is methylated to form methyl tetrahydrofolate, right? Which is methylated to form methyl tetrahydrofolate. The later compound, that is methyl tetrahydrofolate, is the main form in which it is transported in blood, and this tetrahydrofolic acid, it participates in many one carbon transfer reactions. Now let me discuss what are those one carbon transfer reactions. So let me discuss the role of tetrahydrofolic acid in one carbon transfer reactions. Right, role of tetrahydrofolic acid in one carbon transfer reactions. And one of the very important example is the conversion of homocysteine to methionine. Right, let me just give you the sequence starting all the way from your folic acid. So what does this folic acid contains? It contains pteridine, it contains PABA, that is para-aminobenzoic acid, then followed by that it also has the glutamic acid, right? Followed by that glutamic acid. So this particular compound, in the presence of the enzyme folic acid synthase, is converted into dihydrofolic acid, right? In the presence of enzyme folic acid synthase, it is converted into it is converted into dihydrofolic acid. Now this dihydrofolic acid, in the presence of enzyme dihydrofolic acid reductase, is converted into tetrahydrofolic acid, right? In the presence of enzyme dihydrofolic acid reductase, it is converted into tetrahydrofolic acid. So this tetrahydrofolic acid is the one which involves in the one carbon transfer reactions, and one of the very important one carbon transfer reaction is conversion of the homocysteine to methionine, right? This homocysteine this is converted into, right, this is converted into methionine in the presence of vitamin B12. Right, in the presence of vitamin B12, the homocysteine is being converted into methionine. Or this tetrahydrofolic acid is also required for the conversion of DUMP to DTMP. Right, for the conversion of DUMP to DTMP. And here also your tetrahydrofolic acid is required. And along with the tetrahydrofolic acid, the another important enzyme is thymidylate synthase. Right, the very important enzyme is thymidylate synthase. So these are the one carbon transfer reactions which are involving diet or involving tetrahydrofolic acid. Now whenever there is deficiency of the folic acid, already I have said you, the individual will develop megaloblastic anemia. Now this megaloblastic anemia is also seen due to deficiency of vitamin B12. Right, this megaloblastic anemia is also seen due to deficiency of the vitamin B12. So the point you should remember is that megaloblastic anemia, which is due to folic acid deficiency or vitamin B12 deficiency, cannot be distinguished only based on the megaloblastic anemia. In case of vitamin B12 deficiency, along with megaloblastic anemia, these individuals, they will also develop peripheral neuropathy. Right, these individuals, they will also develop the peripheral neuropathy in case of vitamin B12 deficiency. Now, by the presence of your peripheral neuropathy, you will be able to differentiate whether it is folic acid deficiency or the vitamin B12 deficiency. Now, what are the main uses of the folic acid? So, if you see the uses of the folic acid is used in the treatment of megaloblastic anemia, right, used in the treatment of the megaloblastic anemia. And this folic acid deficiency will occur either due to dietary deficiency of the folic acid. Right, what are the causes for folic acid deficiency? One is your dietary deficiency of the folic acid, and the other causes for folic acid deficiency is malabsorption. Right, the food contains adequate amount of the folic acid, but there is malabsorption. And this particular malabsorption could be due to any GI pathology which is affecting the jejunum, because jejunum is the most common site or the site where the maximum amount of the folic acid absorption occurs. So if there is any pathology at the level of the jejunum, the folic acid absorption does not occur, and that will result in folic acid deficiency. Then followed by that, the drug toxicity or the phenytoin, right, or the phenytoin therapy or phenytoin treatment. So what is this particular phenytoin? It is an anti-epileptic drug, right? So phenytoin therapy is also responsible for this folic acid deficiency. Then followed by that, chronic alcoholism. Right, the other important thing is chronic alcoholism. So even your chronic alcoholism will also cause this folic acid deficiency. Next, now folic acid, it is indicated in the treatment of megaloblastic anemia, and it is also indicated in pregnancy. Right, folic acid supplementation is also indicated, right, it is also indicated in pregnancy. Why? Because this folic acid supplementation will prevent the neural tube defects in the fetus. Right, it is also indicated in pregnancy to prevent right, to prevent the neural tube defects in the fetus. Next, and when should this folic acid be started? This folic acid should be started as soon as the pregnancy is diagnosed, right? As soon as the pregnancy is diagnosed, the folic acid has to be started. Next, the other thing is we have a form of the folic acid that is leucovorin, which is nothing but the folinic acid, which is nothing but your formyl tetrahydrofolic acid, or it is also called citrovorum factor. This can be used to prevent the toxicity of methotrexate. See, we have a very important drug that is methotrexate. This methotrexate, it is a folate antagonist. And where do we use this methotrexate? This methotrexate, it is used in the treatment of the rheumatoid arthritis. And the dosage of methotrexate is around 5 milligrams to 20 milligrams. And this has to be given once weekly. And once weekly in the sense, like for example, if you are giving this methotrexate on Sunday, the remaining 6 days you need to give this particular folinic acid, which is nothing but leucovorin. So, because methotrexate is the folate antagonist, you need to supplement this leucovorin. Now, this particular leucovorin, what are the other names of your leucovorin? It is also called folinic acid, right? It is also called folinic acid, or it is your formyl tetrahydrofolic acid. Right, or it is your formyl tetrahydrofolic acid or the citrovorum factor. So, this particular leucovorin can be used to prevent the toxicity of the methotrexate. So, this is about the usage of folic acid in the 1-carbon metabolism, and then what will the deficiency will cause. So, just to have a short recap, the folic acid, which is constituting the pteridine para-aminobenzoic acid and glutamic acid, is converted into dihydrofolic acid in the presence of enzyme folic acid synthase. Then this dihydrofolic acid is converted into tetrahydrofolic acid in the presence of dihydrofolic acid reductase. Now, this tetrahydrofolic acid, it is required as a cofactor, right, or it is involved in the 1-carbon metabolism, and one of the very important 1-carbon metabolism reaction is conversion of homocysteine to methionine, and this also require even vitamin B12. And deficiency of this particular folic acid will result in megaloblastic anemia. And this megaloblastic anemia is not just seen only because of the folic acid deficiency, it is also due to vitamin B12 deficiency. Then how will you distinguish both? In case of vitamin B12 deficiency, you will have additional peripheral neuropathy, because vitamin B12, it is required for the formation of the myelin sheath, and if there is vitamin B12 deficiency, that will lead to demyelination, and that will make the individual to land up in peripheral neuropathy. Next, then what are the main uses of the folic acid? Main uses of folic acid are in the treatment of megaloblastic anemia due to folic acid deficiency, right? And what are the causes for folic acid deficiency, right? Either it is dietary deficiency, or it is due to malabsorption, phenytoin therapy, and chronic alcoholism. And this folic acid, it is also indicated in pregnancy to prevent the neural tube defects in the fetus. And this folic acid should be started as soon as the pregnancy is diagnosed, right? And this folic acid in the form of folinic acid is also given along with methotrexate, because methotrexate is a folate antagonist, and this methotrexate is used in the treatment of rheumatoid arthritis. So in rheumatoid arthritis, once weekly you need to give methotrexate, and the remaining 6 days you need to give this leucovorin, which is also called folinic acid, or it is also called formyl tetrahydrofolic acid or citrovorum factor, right, or citrovorum factor. So this is about the metabolism of your folic acid, uses of folic acid, and what will happen if there is folic acid deficiency. Now, after having discussed about the very important hematinic, that is folic acid, let me discuss another very important hematinic, that is vitamin B12.